First question.
As you all know, who know me, who remember Bayport schools, know I'm a kid person. And there is one aspect of Medicaid expansion that hasn't been mentioned. We don't have very much prevention in serious things that our kids are suffering for and our families, because Florida doesn't provide a code so that people who want to help prevent our kids from getting into trouble can draw down Medicaid dollars. It doesn't make sense. Why not in Florida? And I don't hear it mentioned. Yes, it's important for our health care, but it's important too that we do something to help strengthen prevention programs, to help save our children and our families.
We have some programs, but they're underfunded. We don't have the staff that we need, but we do address these needs through our behavioral health care program at CHI. We have the therapists, we have the case managers, but we certainly don't have enough to cover this entire community. And so what she's saying is true. If we could draw down those Medicaid dollars, we could have more staff to address the needs of these children.
Mr. McGee is third period. Mr. McGee used to be a wrestler at South Bay High School, and he understands what hard work is all about. So, Mr. McGee, it's third period. You can't quit, and you can't stop moving. You must make a score in order to win the match. This score that you'll win this time is for the people of South Dade and all of the state of Florida. So you got to work as hard as you ever have. As a former coach of Mr. McGee, I know that Mr. McGee is of great character. And I'm here to support him in his election campaign. I was there to go door to door. Though he didn't come solicit my help, I did it anyway because I know the character of the man. Okay. My question is to the legislators. We understand that there's a problem. We understand that there's money left on the table. We understand that we all are going to need health care eventually, even if we're of the best of health right now. What do we need to do as a community? What do we need to do, and how do we make the change to rescind the governor's order, rescind the decline of the legislation that would be needed in order to accept it? What processes are already in place, and tell us exactly what we need to do. And I also need to know about the Republican delegation from Dade County. What was their position, and how do we bring them on board for the representation of all of Dade County?
You have to keep the issue alive. We have to be active. And if we're not, then it goes away, and they feel no pressure to do it. So it's up to us to put the pressure on the governor, who has the power to call a special session. It costs millions of dollars to call a special session. So he's not going to call a special session if he thinks that he goes back. He wants Medicaid expansion. The Senate, like Representative Thurston said, wants Medicaid expansion, but then the House, the Republicans in the House still don't, if there's still no deal to be cut. So we need to put pressure on Republicans. The strategy that we are working with, and we're very public about, we need to find Republicans who are less afraid of being primaried by other Republicans. They were threatened, and I'm going to share the story, Matthew. When we started to put, SEIU and coalition partners that are sitting here at the table, put out TV ads and radio ads to encourage these legislators to do the right thing. And when some of them started to break and say, I know this is the right thing to do, Republicans, they got called into a meeting where they were spoken to by their leadership and told if they broke on this issue, that they would be primary. They would put a Republican candidate to run against them and beat them. And so they are afraid, and we need to put enough pressure on them that they understand there's more to lose at home by not doing what's right for their communities than it is by just going along, getting along. So the two things we need to do is get calls to the governor, and then we need to, where we can, and have the power to be reaching out to these representatives to put pressure on the Republican House leadership to do the right thing. And right now, I send out flyers. I think people have them. They have the Florida flag on them. We have an 866 number with the list of legislators that we want calls going to, so use that number. We also have the governor's number on there. We're asking everybody, you make a call and get 5 other people to make a call. Just do that, and that would be amazing. The other things that I think we can do locally is like, if the press isn't covering this, then it's not happening. And so we can get on radio shows, we can call in, we can send letters, and get the attention back on this issue, to stay on this issue.
My name is Trey Evans. Can somebody please tell me why does it cost millions of dollars to bring people back to the job?
I can pretty much chime in on that one too. Because you have to pay us more money. First of all, you have to pay for the staff at the Capitol. You have to pay for the travel. You have to do the reimbursement. All that money, when you can actually pay $8 a person to give them insurance. You know, it just doesn't make any sense.
I am very much aware that you have leadership in both the House and the Senate, and that's that one person. But behind those two, there has to be another. There has to be another person that you, as a beginner in the House, can see that others go to. Give us that name. And that's the person we need to contact in order for them to nudge the one at the higher level.
She quit. And Dr. Marshall is correct. There's always a person behind the scenes. But I think on this one, this is where you have the governor who has aligned himself with the president, who's aligned himself with big business, who's aligned himself with hospitals, and the only person who's on the item by himself at this particular time is the Speaker of the House, who chooses not to bring this particular bill to the floor to be heard. So, Dr. Marshall, what we'll do after this, we can get that information out to everyone who basically signed the petition. I'll get with you, and I think the person we need to go to, we said it before, they've said it over there many times, is going to be directly to the governor. So when he shows up again, we just got to remind him that, hey, there are folks in this county that actually need the actual health care.
I'm Millie Herrera with the Department of Labor, and I wanted to let you know that the Department of Labor, with the IRS, Department of Justice, and with Health and Human Services, we're working to implement the Affordable Care Act. The president has deployed us out into everywhere because we have a piece. We have an agency within the Department of Labor that is going to do the compliance for all the businesses. So we are the spokespersons, and the president, by the way, is right now the Health and Human Services is issuing a ruling in the next couple of days that is going to move 1 year forward the disproportionate share of hospitals. So there's going to be a comment period that I know that it's a little bit complex and I don't even understand it fully, but I know that it's something that you're going to be seeing in the next couple of days that I'm going to send to all the legislators so that you start pushing the information out. Everybody needs to comment and say, we need this, because it's really important that we give a chance to all of our states that are lagging behind. And do what these nice folks are telling you to do. Please make phone calls. I can't tell you how important it is for the government to hear from you. So thank you very much.
If you don't inform and you don't come together as a whole, you can't make an impact. We only got so few people in here today. I'm very active in the Richmond Heights community, and I'm definitely concerned what happens to the elderly people and people in general. But in order to make a difference, we need to make an impact. And we do need to make a change. And this is the time that we need to make a change. And we need more people involved and more people, young people, to know that what we discussed today needs to be spread through word of mouth. Because if we don't have that, we have nothing. We defeated the purpose.